Today, December 16, 2025, marks a pivotal moment in global public health. Around the world, people are tuning in, aware that something extraordinary is unfolding, an event that will shape the future of healthcare for generations to come. The air is filled with anticipation, as communities everywhere await the outcome of a decision that has the potential to transform lives on a global scale. At the 80th United Nations General Assembly, world leaders, health ministers, and advocates from every continent have gathered in a rare display of unity. Today they adopted a groundbreaking declaration that promises to reshape the very foundation of health policy and practice worldwide. The atmosphere in the Assembly Hall is electric, as applause breaks out and delegates from diverse nations exchange congratulatory handshakes, recognizing the magnitude of what has just been achieved. The declaration, titled, "Equity and Integration, Transforming Lives and Livelihoods Through Leadership and Action on Non-Communicable Diseases and the Promotion of Mental Health and Well-Being," is more than just a document. It is a bold promise, a commitment to treat mental health with the same urgency, resources and respect as physical health. For decades, mental health has been sidelined, often overlooked in favor of more visible physical illnesses. But this declaration signals a new era, one where mental and physical health are seen as inseparable pillars of well-being. For the first time in history, mental health conditions are formally and explicitly linked with non-communicable diseases, such as heart disease, diabetes, and cancer. This recognition is monumental. It means that the world now acknowledges the profound impact that mental health has on physical health, and vice versa. Patients in clinics and hospitals will no longer be treated as just a collection of symptoms, but as whole people whose minds and bodies are deeply interconnected. This declaration shatters the outdated division between mind and body, acknowledging there is no health without mental health. It recognizes that emotional well-being is just as vital as physical recovery, and that support for mental health must be woven into every aspect of healthcare. The stories of patients who have struggled in silence, and of families who have faced stigma and misunderstanding, are finally being heard at the highest levels. The mind and body are intricately connected, influencing each other directly. Stress, anxiety, and depression can worsen physical illnesses, while chronic diseases can take a heavy toll on mental health. By integrating care for both, the declaration paves the way for more compassionate, effective, and holistic treatment. It encourages healthcare providers to look beyond the surface, to understand the full picture of a patient's health, and to offer support that addresses every aspect of their well-being. Despite initial disagreements and the complexity of global politics, consensus ultimately prevailed. Delegates debated passionately, bringing their unique perspectives and concerns to the table. Yet, in the end, the shared recognition of the urgent need for bold, unified action overcame all barriers. This moment of agreement is a testament to the power of collaboration and the shared human desire for a healthier, more equitable world. The declaration represents a true paradigm shift. It positions mental health as a universal human right, essential not only for individual happiness, but for the sustainable development of societies everywhere. Activists, healthcare workers, and ordinary citizens have long called for this recognition, and today, their voices have been heard. Communities can now look forward to a future where mental health support is accessible, stigma is reduced, and everyone has the opportunity to thrive. The declaration provides a comprehensive framework for building integrated, equitable, and effective health systems. It calls for investment in mental health services, training for healthcare professionals, and the development of policies that address the social and economic factors affecting health. By fostering collaboration across disciplines and sectors, it aims to ensure that no one is left behind, regardless of their background or circumstances. This is the start of a new chapter in global health, a chapter defined by compassion, inclusion, and the recognition that true well-being encompasses both mind and body. As the sun rises on this historic day, the world moves forward with renewed hope, united in the belief that health is a right for all, and that together we can build a brighter, healthier future. A declaration's power is not just in the words written on paper, but in the real-world change it can spark. When world leaders, policymakers, and advocates come together to set bold goals, they lay the foundation for a future that is healthier, more equitable, and more hopeful for everyone. The United Nations' latest initiative is a testament to this spirit of ambition and collaboration. The true impact of a declaration is measured by the actions it inspires in communities, governments, and individuals around the globe. It's about turning promises into progress and aspirations into achievements. Every step taken, no matter how small, contributes to a larger movement for change. To drive this progress, the United Nations has embedded a set of clear, measurable goals known as the 150-150-150 framework. This ambitious plan is designed to accelerate global health improvements by the year 2030, providing a roadmap for countries to follow and benchmarks to measure success. The framework is not just a set of numbers, it's a call to action for governments, organizations, and citizens everywhere. The first target is to increase access to mental health care for 150 million more people worldwide. This is a critical step, as millions still struggle in silence without the support they need. By expanding mental health services, training more professionals, and reducing stigma, we can begin to address the massive unmet need that affects families and communities everywhere. This target recognizes that mental health is just as important as physical health, and that everyone deserves the chance to thrive emotionally and psychologically. The second target is equally bold: to reduce the number of tobacco users by 150 million people. Tobacco use remains one of the leading causes of preventable illness and death, fueling the global epidemic of non-communicable diseases like cancer, heart disease, and stroke. By focusing on prevention, education, and support for quitting, this goal aims to save millions of lives and reduce the burden on healthcare systems worldwide. Achieving this ambitious reduction will require a multifaceted approach: stronger regulations to limit tobacco marketing and sales, widespread public awareness campaigns to educate people about the risks, and accessible cessation programs to help users quit for good. Collaboration between governments, health organizations, and communities will be essential to make this vision a reality. The third target focuses on another silent epidemic: hypertension. The goal is to ensure that 150 million more people have their high blood pressure under control by 2030. This emphasizes the importance of strong primary healthcare systems, regular screenings, and early intervention. Uncontrolled hypertension is a major risk factor for heart attacks, strokes, and kidney disease, but with the right support, it can be managed effectively. Routine screening, affordable medications, and ongoing education about healthy lifestyles are crucial to achieving this target. Empowering people with knowledge and resources enables them to take charge of their health, make informed choices, and prevent complications before they arise. Together, these three targets form a balanced and comprehensive approach to global health, addressing both mind and body, prevention, and treatment. By working towards the 150-150-150 goals, we can create a future where more people live longer, healthier, and happier lives, and where no one is left behind on the path to well-being. To truly appreciate the significance of the United Nations Declaration, we must first grasp the immense scale and complexity of the crisis it seeks to address. This is not just a matter of policy or politics, it's a matter that touches the lives of billions across every continent, culture, and community. Around the world, mental health conditions and non-communicable diseases, often called NCDs, have become some of the most urgent and widespread health challenges of our time. The numbers are staggering, and the impact is deeply personal for so many. Over 1 billion people are currently living with mental health conditions. These conditions do not discriminate. They affect children, adults, and the elderly, regardless of nationality, income, or background. The emotional and social toll is immense, often leading to isolation, stigma, and lost opportunities. At the same time, non-communicable diseases like heart disease, cancer, diabetes, and chronic respiratory illnesses have become the leading causes of death worldwide. These diseases account for nearly 3/4 of all global deaths each year, affecting families and communities everywhere. The prevalence of both mental health conditions and NCDs is rising at an alarming rate, putting immense pressure on already overburdened public health systems. Hospitals and clinics struggle to keep up, and healthcare workers face mounting stress as they try to provide care for growing numbers of patients. Vulnerable populations, especially young people, are being hit the hardest. Many children and adolescents face barriers to care, and the consequences can last a lifetime. The burden is even greater for those living in poverty or in areas with limited access to healthcare. The UN Declaration places a strong emphasis on equity, aiming to ensure that efforts to address these health challenges reach marginalized and underserved communities. No one should be left behind, regardless of where they live or their circumstances. It's important to recognize that mental health conditions and non-communicable diseases are deeply interconnected. People living with mental health issues are at higher risk for developing NCDs, and those with chronic physical illnesses often experience mental health challenges as well. By linking these issues, the United Nations is urging the world to see each person as a whole, not just a collection of symptoms. Integrated care, addressing both mental and physical health together, is essential for effective treatment and for building healthier, more resilient communities everywhere. Recognizing mental health as equal to physical health in a UN declaration is monumental. This document codifies mental health as a fundamental human right globally. It provides a tool for citizens and organizations to hold governments accountable. Legal recognition dismantles systemic barriers in mental health care. The declaration challenges discriminatory practices, ensuring parity in funding and access. It combats stigma, normalizing mental health conversations, and empowering individuals. The framework strengthens international cooperation, mobilizing resources and efforts globally. The UN Declaration champions a whole-of-government approach. Health is influenced by decisions across all government sectors. Breaking down silos, ministries can implement policies promoting health. Education and finance play crucial roles in mental well-being and funding. The approach ensures health is considered in all policies, making healthy choices easier. Beyond government, the declaration calls for a whole-of-society approach. Engaging civil society, private sector, and individuals is crucial. Civil society groups provide support and advocate for better services. The private sector can create healthier products and promote well-being. Communities foster environments supporting mental health and reducing stigma. The UN established process targets for national systems to achieve by 2030. These targets ensure progress is built on a sustainable foundation. Key targets include comprehensive policy measures and strengthened primary health care. Financial protection policies prevent health-related poverty. Multi-sectoral plans and surveillance systems track progress and adjust strategies. The declaration positions health investment as an economic imperative. Unwell individuals are less productive, impacting economies. Mental health issues cost the global economy $1 trillion annually. Increasing access to care unlocks human potential and boosts output. Prevention of non-communicable diseases is a smart economic investment. The declaration strengthens the framework of the 2030 Agenda for Sustainable Development. A healthy population is essential for achieving various SDGs. Mental well-being and disease prevention create conditions for academic and economic success. The declaration supports equity, reducing inequality, and promoting inclusive societies. It unites the world around a vision of equal mental and physical health, accessible care, and a healthier future.